Now, when it comes to evaluating a patient with syphilis, it is very high yield to remember the diagnostic tests, as these will help you throughout your medical school as well as when you start practicing medicine. So let's get into a bit detail about the tests.
So guys, testing strategies for syphilis consists of dark field microscopy and serological testing. Now what you need to know is that dark field examination by microscope allows for direct examination of spirochetes from the mucosal lesion and thus offers an immediate diagnosis. Now the serological tests are classified as non-treponemal and treponemal tests. The non-treponemal tests, such as the Venereal Disease Research Laboratory Test, or simply called VDRL, and the Rapid Plasma Reagent Test, simply called RPR, are screening tests that detect antibodies to cardiolipin in the blood. The VDRL and RPR tests are only positive after the development of the primary canker. So this point is high yield to remember. Now, positive non-treponemal tests are confirmed with treponemal tests, which include fluorescent treponemal antibody absorption assay, Treponema Pallidum particle agglutination assay, that basically detects antibodies to the Treponema pallidum in blood. Now, some important pointers to remember. Always remember that syphilis is a reportable disease. If you see syphilis in the clinics or in the wards, you have to report it. Secondly, patients with neurological symptoms, which we have already discussed before, they should undergo immediate CSF examination. Test the spinal fluid with VDRL or FTA-ABS, which is the fluorescent treponemal antibody absorption test, or you can also perform a PCR test as well, which is polymerase chain reaction. Third, all patients with syphilis should be tested for other sexually transmitted diseases. In addition, syphilis is routinely tested for during the first trimester of pregnancy. If the testing is positive, benzathine penicillin G is administered immediately, as transplacental admission occurs after first trimester. Fourth, imaging studies depend on the organ involved. A chest X-ray may be the first clue to the presence of an aortic aneurysm. A CT scan can confirm this. An echocardiogram is needed to rule out aortic regurgitation. So these are very high yield points, and it's imperative to keep them in mind whenever you're managing a patient with syphilis.